Hi there, hope you're doing well. We have been discussing about the different types of eating disorders such as anorexia, bulimia, etc. So in this video, let's have a look at what eating disorders mean and what are the general causes and the common symptoms that are associated with eating disorders. Now, eating disorder is actually a range of psychological conditions which eventually leads to the development of unhealthy eating habits in a person. So this is characterized by extreme disturbances that are happening to the person's eating habits, or the disturbances to their thoughts and feelings surrounding food, surrounding the body image, surrounding their weight. When all of this gets affected and it ultimately leads to an unhealthy eating habit, that's exactly what we call as an eating disorder. Now, eating itself, eating as an activity itself is something that is affected by our genes, by our upbringing. The way you or I eat may not be the same because we have been brought up in different ways. Our mental health at a particular period of time. If I'm very upset, I may not be able to eat something. So generally also eating is something that is affected by a range of factors, which also includes the media imagery, what the media says, how it affects our mind, the biological changes that we are going through. Even injuries and surgeries can change our eating habits. But when all of this results in a set of unhealthy conditions to develop around eating, that's what we call as an eating disorder. Now, there are different types of eating disorders, especially 8 types, based on 2 different manuals. These are the official manuals. That is, the first one is ICD, which stands for International Classification of Diseases. And the second one is DSM-5-TR. DSM is the abbreviation for Diagnostic and Statistical Manual of Mental Disorders. And 5 is the 5th edition. TR stands for the text revision. So in these two manuals, these two official manuals together give us 8 different types of eating disorders. But then apart from these 8 types, many psychologists have come up with some unofficial types as well. We'll discuss about them in our next video. Now each type of eating disorder is having its own unique risk factors, its own consequences, its own treatment plans, and they cause a range of symptoms which can be either mental health symptoms or it can be physical health problems. So we'll have a quick look at what are the common symptoms that can be seen in a person who's suffering from eating disorders, though individually each disorder has its own set of symptoms. Now, one thing to remember is that these eating disorders can affect anyone. It can affect any gender. It can affect any aged person. It can affect anyone, from any cultural background, because there is no restriction that only girls are affected or only young children are affected. No, there is no restriction on that. It can develop at any point of time. First, it is usually seen during the adolescence or the young adulthood period, because that is the age where there's a lot of preoccupation with food, with the body shape, a lot of hormonal changes are happening. There's a lot of weight gain or loss that happens at that period, which causes distress. So that is the age. The young adulthood is the age, or the adolescence is the age where there are a lot of transitions happening and there's a lot of range of emotions that's happening, which can lead to erratic behavior around food and nutritional deficiencies. But then that doesn't mean that older people don't develop any kind of eating disorders. Even in older people, it has been seen that eating disorders can develop. Now, these are some of the common symptoms that can be associated with an eating disorder. Like I told you earlier, these symptoms may be behavioral or related to the mind, or they may actually pose as physical problems in the person. So the mental signs or the behavioral signs or changes include concern about eating in public because they have intense fear of gaining weight, or they are just having too much of preoccupation with food, with calories, with the amount of fat that they take in. They do a lot of dieting. Sometimes they have unusual eating habits. For example, they may eat very rapidly, or they may be cutting the food into really tiny pieces, or they may be hiding food. Many a times people who have eating disorders, they dress in layers. They dress in several layers because they want to hide the weight loss, or even sometimes it is because they have lost so much weight that they need to stay warm. They severely restrict or limit the amount of food that they consume, the type of food they consume. They refuse to eat certain foods. They deny feeling hungry. They sometimes they have a feel of they feel a need to burn off calories, or doing excessive exercise, repeatedly weighing oneself, patterns of binge eating and purging, or sometimes they have rituals around food. All these, or there's also something where people cook meals for others but they do not eat, and often such people keep commenting about being fat or flawed in appearance. Any kind of such symptoms or withdrawal from any social activity that involves food is considered as the behavioral symptoms or signs of an eating disorder. Physical signs are also there. For example, the person may have dramatic weight loss. There may be they may be suffering from stomach cramps or any other kind of gastrointestinal symptoms, because now they have messed with their food intake. They may have difficulty in concentrating. They may show a lot of atypical lab test results. For example, they may have differences in the thyroid levels, low thyroid level, low hormone level. They may sometimes have anemia, low potassium, low blood cell count, slow heart rate. These are all associated with eating disorders. The people who have eating disorders, because they have abnormal electrolyte levels, usually they'll have common dizziness and fainting episodes. They feel cold all the time because they don't have fat in their body to keep them warm. They have sleep irregularities, menstrual period irregularities. They may have calluses on that hard thick skin that may develop across the top of the finger joints. This usually happens when a person eats and vomits out food. So because they are continuously putting their finger inside their mouth to vomit food, they may develop calluses on the top of the finger joint. This is a very typical sign that they are inducing vomiting. Not only that, because their nutrient is not enough in their body, they often have very dry skin, brittle nails, hair loss is common, muscle weakness, their wounds don't heal properly, and overall they have a poor immune system function. So these are some of the common signs and symptoms of an eating disorder. Like I told you earlier, each disorder has its own typical symptoms, but these are some common ones that you can watch out for in your loved ones. When we see the causes of the reasons why these disorders develop, experts have believed that there are a variety of factors that contribute to eating disorders. It's not one or two, it's a mixture of everything. For example, there could be biological factors, biological causes, such as the genetic predisposition or an imbalance in hormones in our body. So people who have a sibling or a parent who has an eating disorder, they have increased risk of developing one. So that is the meaning of a genetic disposition. There could be psychological factors. This is very, very important, because a person with low self-esteem, a person who wants to be perfect, who exhibits perfectionism, always wants to be perfect, has depression or anxiety, such people are prone to develop eating disorders. So social and cultural influences which promote an unrealistic body image or unrealistic body standards, or social influence which rewards thinness, these are also associated with disordered eating behaviors. So especially if even in the family, if they are having, if they in the family or their friend circle, if a thin person is being modeled as the perfect person, automatically it affects the child or the person, and they also tend to get influenced by it, developing an eating disorder. Traumatic experiences in their childhood or adulthood, for example, it could be an emotional experience, a physical abuse, a sexual abuse, any kind of stressful life event. It could even be something as bullying or the death of a loved one, not able to come to terms with it, or loss of a job. These are all stressful traumatic conditions in life which may result in a person developing an eating disorder. There are also medical conditions which can lead to eating disorders and malnutrition. For example, if they have had a surgery and they're unable to eat food, they'll ultimately it can happen that ultimately they develop an unhealthy relationship with food. They just don't want to eat anything. So even medical conditions can contribute to having an eating disorder, but it's usually a combination of 2 or 3 of these factors which results in a person having an eating disorder. So I hope this video was useful to all of you to understand what an eating disorder means, what are the common symptoms of eating disorders, and how these eating disorders get developed. In the upcoming videos, we look at each one of the eating disorders in detail. I hope to see you all in the next videos as well. Bye.